showing you today somebody that I have ultimate respect for, ultimately trustworthy, very creative in what she has decided and figured out and come up with herself. She's a doctor, but she's entirely into healing, not creating problems with people. And I want to introduce to you so she can tell you about herself and about what she wants us to know. Dr. Hyla Cass.
Thank you for that great introduction. I really appreciate it. So here we are, we're talking about redefining medicine. And I'm really excited. I'm going to tell you the way I practice medicine, the way I have for the past, I don't know, probably 40 years. And in this presentation, I'm not going to give you a lot of specific, do this, do that, do that. It's more, I will give you resources and concepts that you can follow through on your own, so that it's kind of the difference between giving people fish and teaching them how to fish. So I'm going to teach you how to fish in the world of functional and integrative medicine. So it's, I'll tell you how I started. I started by being a doctor's kid. And my father practiced out of our home in Toronto. We had a beautiful finished basement. It was not a cellar, a really lovely basement with a number of rooms, including a waiting room and office room and all kinds of things. It was very professional. And I was the doorkeeper. Starting at age about, I don't know, 3, 4, I would answer the door. And I would see him with his patients in the waiting room. They would talk to me, and I had a real sense of what healing and health was. There weren't a lot of pills in those days. Penicillin came in while I was a child. That's how long it was. So it was a total inspiration to me. And then my father always encouraged me to go into medicine, and actually even took me to the Women's College Hospital and introduced me to women doctors to show women can do this. You know, there were 6 women in my class of 120 at University of Toronto. That was in those days. Now there are more women than men in medicine. But I consider myself really lucky to have been able to have that early exposure, encouragement, mentorship, which brought me to here. And I've always thought outside the box. I mean, even in high school, I was looking at alternatives. I was looking at consciousness, about psychic phenomena, past lives. So I was always kind of on another planet, or at least not following the mainstream. These are some of my credentials. By the way, if you want these slides, they're going to be available afterwards, so you don't have to worry about copying down information, which can be a distraction. So you have access to the whole show. These are some of my credentials, just to show that I'm for real. And what's interesting is I'm a diplomat of the American Board of Psychiatry and Neurology, which sounds like psychiatry is just about the brain, but it isn't. When you're practicing psychiatry the way I do, it's the whole body. I had to learn all of functional medicine, and I had a really good grounding in traditional medicine, which I thought was really good. It was very useful. It's what you do with that information, what you do with that knowledge, that makes the difference in your practice and how it's delivered. And actually, it's been failing us. Standard of care medicine has really been failing us badly. You know, we have built into us a really good natural pharmacy. Now, do you think that when you have surgery or take medicine, that that's what's healing you? Or is it enrolling your own healing ability? And then your belief system, your faith in what's happening, positive thinking. So much goes into the healing process. So the idea of a pill for every ill just doesn't cut it. And we know that. Not only is it not useful, it covers over the symptoms, and it often has side effects that are worse than the thing that you started with. And then to deal with the side effects, what do? You take more pills. And it's getting really crazy. And the people that are benefiting are it's mostly big pharma and the insurance companies. The doctors themselves are pretty stressed. The mic went out, okay.
Big Pharma just turned off the sound.
Yeah, the AMA is listening to me. Thank you for letting me know. So there are really big limitations to standard of care medicine. It's isolating the various symptoms instead of doing whole person care. We're interdependent, we have interdependent systems. So rather than cardiology, nephrology, psychiatry, it's really looking at the whole person, looking at their chemistry, their environment, doing lab testing. So many things go into it. It's not just you have a symptom and you get a pill and that's going to solve it. Unfortunately, by the way, people kind of want that. Lifestyle and dietary changes, which are very important. That's what goes into making your body. Your diet, your food, your intake is going to make a tremendous difference. In fact, when I put people on supplements, when I'm about to put people on supplements, but we're just ordering them, they haven't had them yet, so it may take a week or two, they change their diet and they already are feeling better. As soon as they drop the sugar, the processed foods, the junk food, the chemicals, then it's amazing. They begin to be normal and they can see how their food really does affect their mood. And what we're having now in the US is that 90% of the nation's $4.5 trillion annual healthcare expenditures are for people with chronic physical and mental health conditions. Now that's crazy. These are some of them: heart disease, stroke, cancer, diabetes, obesity. Listen to this. I mean, you got to see this. 20% of children and 42% of adults are obese. This is a serious health crisis. Arthritis, Alzheimer's disease. 1 in 9 adults age 65 and older will at some point develop Alzheimer's or some form of dementia. We usually just put it all under Alzheimer's, but there are actually fine-tuned different types of dementia. And the psychiatric, I mentioned the Meds for Life thing, that's American. That is to benefit the doctors, because people keep coming back month after month for their refill, and certainly the pharmaceutical industry. They're very happy that everyone's taking all these drugs. And some of these drugs are pretty dangerous, and I'd like to point this out because people will often take a medication without thinking about it. And they think, oh, well, everyone takes this, it's just a regular one. Like proton pump inhibitors, like Prevacid, Nexium, or Prilosec. So they show these things on TV, right? They show a guy stuffing himself with pizza and all kinds of crap, and oh, he gets heartburn. No kidding. Really? And then it shows him dropping a little purple pill, and voila, he's okay, and he can eat more of that. Like what? So the fact is, this is something that you may not know, very important, that when you have heartburn, or gastroesophageal reflux is the official name, when you have acid that kind of comes up into your throat and you taste it and it's yucky, well, then it burns. What's really so is that you're deficient in hydrochloric acid. It's not that you have too much. Does anyone know this already? Oh, great, great. So for those of you who know it, it's a reminder, and to remind other people about it. The acid blockers, as I said, those of you who know about it, great. Those who don't, you've learned something. And there are other things you can do. If you're having heartburn, it means you have a low acid, and there are many things you can do. I pulled a website here, and as I said, you'll be getting a copy of the slides if you want, so you have this, let me show it, my cursor. It's nativepath.com, and there's a blog on how to relieve GERD without medication. So things like probiotics. Also be sure, to check for something called H. pylori, and so on. Then there's the SSRIs, the antidepressants, and guess what? Depression is not a Prozac deficiency, or Zoloft deficiency, or Effexor, or any of those. And the bad news is, these SSRIs and their sister medications, the SNRIs, which are even more potent, increase the risk of suicide and homicide. I had a woman, a friend who I ran into somewhere, and she said, I just want you to know I was put on Prozac. And I started to hear, it's not exactly voices, she said, but I had this strong impulse that I had to kill myself. And she said, I didn't know where it was coming from, and it was really scary. She wasn't that depressed, and she'd never had suicidal thoughts before, and she herself figured out that it had to do with the medication, stopped it, and the thoughts went away. So it's a total alien thing. There are tragic cases of people killing their families or committing random homicide being on the meds, when before they were on the meds, they were never that way. So really important to be respectful of meds, and we have such better ways of handling this. And the side effects are pretty bad. Sexual side effects, the risk of developing bipolar illness. You'll notice we have way more bipolar than we ever had, right? Why? Because we have more people on antidepressants. And what the doctors say is we've uncovered, unmasked a hidden potential for manic depressive illness. No, you have created it. And that person should be off of all meds and be evaluated for their total physiology and have that corrected. And they won't have that diagnosis, they won't be on the meds, and they'll have a much happier life. So that's for that. When you're stopping the SSRIs, the way I do it when I take people off, I'm one of the few people who actually do this, and it's not fun even for me, but I appreciate that I can do it. What I do is check them for everything else that could be underlying, the underlying condition that brought them to the psychiatrist in the first place to prescribe the meds, and sometimes it's just the family doctor prescribing an antidepressant. Now that's kind of scary. And I evaluate them, I do lab testing, figure out what's out of balance so they begin to come into balance, give the missing nutrients, and then gradually withdraw the medication. And it may take a few months or longer, but they're off the meds, they're not suffering from terrible withdrawal syndrome. Some of them are like brain zaps. Has anyone heard of brain zaps? The people going off of SSRI have these shocks in their brain, and it's really distressing. And so few people know about this. So that's another fact that I'd like you to know. I'm sort of dropping little facts. Here's brain zaps. That keeps changing the slide when I do that. And another thing we use a lot of B12, other B vitamins, because they help to make the brain chemicals. We use amino acids that are precursors that help make our neurotransmitters, serotonin, dopamine, GABA. Some new stuff are psychobiotics, and more supplement companies are coming out with their own psychobiotics, and that means that they interact with the microbiome and actually affect the brain. There's a lot of connection between the gut and the brain. So very often when you have a brain issue, anything from dementia to anxiety or depression, you need to look at the gut. You need to check the gut balance. And the best way to do this is with a stool test. And it's fairly simple. There's some places you can actually go to on your own, but then you need help interpreting them. Actually, RUPA, R-U-P-A, does that. They're a self-service lab where you can order on your own. I think you can order on your own without a doctor. There's also directlab.com that will do that. So psychobiotics, watch for them. So can you imagine, instead of taking Prozac, you take a psychobiotic and you actually heal your gut and heal your brain rather than just giving you something that has a lot of nasty effects and you can't get off of. So which would you prefer? Okay. Statins, oh my God. I get asked all the time, well, what do you think of statins? My doctor says I have to be on them. So let me see, who is one who would not take statins, who understands that statins are not so good? Whoa, preaching to the converted. Thank you. I'm appreciating it. They cause muscle pain, liver damage, increased risk of diabetes, and also this astronaut, Dwayne Graveline, wrote a book about he was an astronaut physician, and he prescribed a statin, it was Lipitor at the time. It was early on, in the early days of the statins. Now we have a lot of fancier ones. So he lost his memory. He absolutely didn't know who he was. He was totally demented. Got off of the statin. I don't know who recommended, I don't remember, I read the book years ago. And lo and behold, his memory came back. It just popped back up. Then after some time, his doctor convinced him that, well, that wasn't really the problem and you really do need statins. Went on them again, lost his memory again. Fortunately, he went back, took himself off of the statin and wrote this book called Lipitor, Thief of Memory. It was very impressive. There's also, they've been banned in Europe. What?
Are you willing to entertain any questions?
Yeah, sure, sure.
I want to say that I was told by several doctors to take statins that I had to.
Well, that you have to.
Yeah,
They
so-
say it very
I
emphatically.
know, so here's the problem. Even if you know better, it's very hard to convince the doctor
You can't.
that you're not going to do it because that is what they learned. And since they have the white coat, I mean, it's really, I've been fired by doctors because I wouldn't take antibiotics. Literally fired. They said you better find another doctor because I knew I shouldn't do it, but in a sense they can't help it because that's what they were taught in the medical school. So how do you recommend that we approach the subject with a doctor when we know we don't want to take it, but we have the weight of the medical?
Then you're right. Then it's hard because if you have insurance, you want to go to a doctor that's covered. But it would be really useful to find one who would not be prescribing statins. There are also naturopaths, by the way. They don't take insurance. They're not covered by insurance, but they're also less costly than regular doctors. And if you go to a functional medicine doctor, you're going to pay more out of pocket because even though they can bill insurance for some of it, it's much more labor intensive when you're a functional medicine doctor. You spend an hour or two for the first visit, and maybe a half hour after that. That's not what's done in regular practice. So you get a lot more attention, but you have to pay for the time. So it's kind of a toss-up, or find a functional or integrative doc who does take it. I mean, that's, homeopathy is great. It's been around for a very long time. Hahnemann started it, although there were probably precedents of it, and very effective. NSAIDs, people think ibuprofen is innocent. No, it can increase the risk of heart attack, stroke, GI bleeding, stomach ulcers, kidney damage. It's like there's no free lunch, guys. You know, when you take a drug, you really need to read up on what it is, and then you won't take it. I wrote a book called Supplement Your Prescription, What Your Doctor Won't Tell You, on drug and nutrient depletion. So a lot of drugs actually deplete essential nutrients like B12 or D and other ones, and then you get sick from that deficiency. So that was a useful book. It did well in its time. And what we do, we who practice the way I do, is we look under the hood. We go beyond the symptoms. It's like mainstream medicine is like you have the light panel, a red light goes on your dashboard, and you put a Band-Aid over it. I don't think you would do that. I think you would go to the mechanic and say, my red light went on, help, have a look. But we don't do that with our bodies. I mean, we do, but that's not what people do. They are other people, they will take something that's like a Band-Aid over the symptom, has no particular healing ability, but will just stop the symptom. And what's a symptom? You know, somebody want to define what a symptom is.
Information showing up somewhere.
Information showing up somewhere. Yes, it's information. Your body is telling you something.
Inflammation.
Information.
Oh, inflammation.
Showing up somewhere.
Symptoms are a message from the body. If you have a headache, it could be any number of things. You don't want to just take a painkiller. You want to say, well, when did I get it? What was I eating? Or maybe you'd been to the gym and you twisted your neck, so you needed to untwist it. That's a chiropractor. And things like that. You need to be able to read the message, and that's what we do. And we do extensive testing to find out. And here's some of the root causes that pertain to really everything, from depression to anxiety to dementia to you name it. Toxins, we have a lot of toxins. Did you notice we have a lot of toxins? In our soil, in the air, we have heavy metals, we have chemicals. There's all kinds of stuff that we ingest through our food, our water. Really, we're breathing it in, it's bad. So we have to stay ahead of it. Another root cause is chronic infections. You can have parasites, viruses, bacterial infection, Lyme, which is a class by itself. So we need to look for root cause as deeply as possible. Nutrient deficiencies. If you're low in vitamin B12, you're going to have fatigue, depression, or if you're low in vitamin D, your immune system is depressed. If you're low in this precursor to serotonin, you're going to be depressed because you can't make that neurotransmitter, and so on. So we check for nutrients. We can do tests that will tell you what the nutrient level of various vitamins and minerals are in your body. Hormonal imbalance is really important. You know that so many women who have Hashimoto's thyroiditis, anyone ever hear of that? Okay, Hashimoto's thyroiditis is an autoimmune condition where your body is acting against your thyroid. And why does it do that? Well, sometimes it's because of different food sensitivities or chemical sensitivities. I've had women, and usually it's women who have Hashimoto's, men can get it too, but women who, with Hashimoto's, when I took them off gluten, I didn't test them for, even before I tested them for that, I took them off gluten, and very quickly, their antibody levels came down. Their Hashimoto's went away. So it's not like, you have an autoimmune condition, you either have to take these very expensive, very strong medications that they advertise on TV, or you're going to suffer from this forever. Well, you're going to suffer anyway. So the better solution is looking under the hood and seeing what's actually out of balance. Trauma, what's good is we're hearing a lot these days about trauma, right? And different ways of healing trauma. We have so many psychological things. We have CBT, EMDR, sensory experiencing, a lot of ways of dealing with emotional trauma. And emotional trauma can be underlying your susceptibility to all of these things. You're more susceptible to infection, for example, if you've had a history of trauma. Because what happens when you have trauma and stress, you go into the fight or flight mode. We have two divisions to our automatic or autonomic nervous system. We have the sympathetic and the parasympathetic. The parasympathetic is the rest, digest, be calm and comfortable. The sympathetic is fight or flight. We gotta run away from the lion or tiger. Now, when you're running away from a lion and tiger, because we have this, it's a vestige of how we were made originally, and if you're running away from a predator, what's gonna happen? You're gonna have dilated eyes, you're gonna have a lot of blood flow to your muscles, your digestion's gonna shut off, your heart rate's gonna go really fast because you need to pump a lot of blood, and a lot of changes are gonna happen. When we're in chronic stress, which is what happens when you've been traumatized, there's an underlying record going on in your body of the stressful memories. So you're in fight or flight all the time. And that's what these people cannot fall asleep. They're jumpy. And what needs to happen is the stress and trauma need to be treated. So even though you have a physical illness, it's really being run by your traumatic situation, your traumatic memory. And some of these techniques are very short and simple. You know, you may have had this stuff for years and years and years, you know, since childhood, but we have techniques that can clear it quite quickly. Anybody here do trauma work? Okay, look at the hands if you need trauma work. Cool, okay. This is just a summary of what I've been saying. That for all of these illnesses, for all these diagnoses, you really need to look at all these root causes. Hormones, digestive problems, detox imbalances, that is, you're not detoxing well. Mitochondria, that's the energy little things in your cell that turn your nutrition into ATP or energy. Look for toxic chemical exposure. Boy, we see a lot of that. You look for inflammation, for structural imbalances, and so on. And some of the things that I've detected over time, heavy metals like lead, mercury, cadmium, really common. You know, this cadmium in cigarette paper. There's lead, there's been leaded gasoline, they don't have it anymore, but a lot of the soil along the edges of roads still carry lead. Mercury from coal, mercury from fillings. Please don't have any mercury fillings because they're going to continue to toxify you. And they're very disruptive, very dangerous, and not so hard to treat. For example, I had this gentleman who had been depressed for years. He was about in his 50s, had been depressed for years and years, and had tried everything, including, and he was very wealthy. He traveled to Europe to look for solutions, couldn't find it. We did a mercury test on him, and we did a heavy metal test, not knowing what we'd find. We found mercury, and when he got chelation therapy, in his case it was intravenous chelation, he was able to get the metal out of his body, and he was normal, and he was not depressed again. Really? You don't have to be on a medication for life, and it wasn't helping him anyway. So that's like an example. Pesticides, do you know that a lot of Parkinson patients are actually, affect the part of the brain that deals with movement, and pesticides, it's very sensitive to organophosphates, glyphosate, and nicotinoids. So when you detoxify them, you can actually reverse the Parkinson's and any cognitive decline they have. So yeah, this also affects your brain in terms of dementia. Food additives, be really careful. We know this, don't eat processed foods. There's lots of chemicals, lots of things in foods that are not food. They're not food. I remember I had one woman with tremendous anxiety. I took a history. She was drinking several Diet Cokes a day. So what do you suppose was going on and causing her anxiety? Aspartame, right. NutraSweet, it's, NutraSweet, Equal, they're not your friend. Don't take them. You can use stevia. I think stevia is about the best. There's also xylitol. I'm sorry? Monk fruit. Monk fruit, yes. Anything else?
Date sugar. Date sugar.
Date sugar? I don't know, that's still sugar. So I'm really careful about sugar. Chronic Lyme is really bad because there's several different bacteria that it can be, and it's a great masquerader. You can't always tell you have Lyme. So these people go from doctor to doctor, spend a fortune, and don't get better until somebody does a really good Lyme test, and then they're treated accordingly. Now, I had one woman who came to me, I don't know, about 5 years ago. She was manic depressive, she was bipolar, and did not want to be on medication. So I treated her without medication, but it was challenging. And for a short period, I really did have her on a medication, but then we took her off it, and she did well. And then 3 years later, she had a relapse. And again, I was treating her, and this time, I mean, she was really, really manic, really out of control, not safe. This time, we did a Lyme test, and she had Lyme, and no one had, for some reason, had ever done a Lyme test. And when it was treated, she stopped being manic depressive or bipolar. And to this day, it's now a couple of years, she's great. She's normal and very well functioning. So keep that in mind. We talked about stress and trauma. Sleep deprivation, really important to get enough sleep. It affects everything. You're not going to save anything by cutting off sleep. We need about 8 hours of sleep. Some people a little less, some a little more, but we need it. Now, here are some issues and contrasts in treatment. I'm not sure I'm going to go over these in any detail because I kind of covered them. Okay, in mainstream medication, in mainstream medicine, they use anxiolytics like Xanax, Valium, Librium. But what we do is we look at the root cause. Like I said before, that woman with the aspartame poisoning had anxiety. Or there's something called pyroluria. Anyone ever heard of pyroluria? Okay, it's a metabolic difference. About 8%, about 11% of the healthy population has this, and it's how you process B6 and zinc. You actually become deficient in B6 and zinc and specific oils, and that's not so bad, except that you don't make your neurotransmitters properly. And if you don't make your neurotransmitters properly, you don't have enough dopamine to feel good, or serotonin, or GABA, then you're in trouble. So when I start off with a questionnaire, I don't even do a lab test for it. Get a questionnaire. If they score a certain amount, they then are put on B6 zinc and certain oils, and they start to get better. They stop being so anxious, and these are people who have been anxious their whole lives. We also add in specific amino acids. There's also psychotherapy and all those other things, of course, but the emphasis as a functional medicine doc is I use natural supplements. And then for depression, we already discussed that. Look for hypothyroidism, heavy metals, chemical poisoning, deficiencies, and so on. So you take a history and you do lab work and treat accordingly. Addiction is really interesting. What addiction is that you're grabbing for something that fills a need in the moment. Let's say you're a sugar addict. You say, oh, I'm just a sugarholic, I can't help it. No, what's happening is there's something deficient in your diet. If you start your day off with some protein and also have more complex carbs, that is not the simple carbs, and eat a better, more balanced diet, more fiber, you actually will decrease your cravings for sugar. It works, it really works. You have to have faith and actually do the dietary changes first. And it's really sad, the addiction treatment centers, they're good on doing, they have support groups, they do mindfulness, it's all really nice, behavioral therapy, but what they don't get, except for the one that I refer people to, called alternativetomeds.com or alternativetomeds.com, right here, they don't address the deficiencies. They don't address what's underlying. So they clean up the heavy metals, they clean up the chemicals, they give the precursors that are missing, the dietary precursors, so that the people can make neurotransmitters. And then the addiction, the cravings, they don't have to white knuckle it. So it's always thought about as willpower. I'm a sugaraholic, I can't help it. And a really good old book is 7 Weeks to Sobriety by Joan Matthews Larson. Old book, oldie but goodie. And clearly you can become sober from alcohol in 7 weeks following that. There are a few other books. I did a book, Natural Highs, with Patrick Holford. He did a book, Optimum Nutrition for the Mind. So I'm giving you resources if you want to look further into any of these. Alzheimer's, it's on the rise. And why? Because we're living in such a toxic environment and people aren't eating whole foods. They're not getting nourished. So, something Alzheimer's or dementia, different forms of dementia, is no different from anything else. You need to look at, I'm getting boring, but look for toxins, look for infections like viral, Lyme, mold, and other treatable conditions. It turns out Alzheimer's is not a dead end. It's treatable. My friend Kat Toops published a paper in a reputable journal. 85% of her Alzheimer's patients were no longer classified as having Alzheimer's at the end of the study. So it's not a death sentence, but you have to be on top of it. You really have to look for all the issues that are, all the biochemistry that's out of whack, take the right oils, and do the lifestyle changes that we were talking about also, like good sleep, meditation, exercise, music, social. And the Bredesen Protocol is a great resource. Just know Bredesen Protocol, look it up online. And he also wrote a book called The End of Alzheimer's, which I didn't cite here, oversight, but it'll show up on his website. Mold exposure, a lot of people don't know that they're being exposed to mold. Anybody have any mold exposure? I've had it. I'm sensitive to mold. I'll be in a home where no one will smell mold but me. And I have other people that I know, it's the same thing, that if you're sensitive to mold, you smell it. If you're not particularly sensitive to it, it's probably not going to hurt you. You're able to detoxify it easily. They don't catch it early, nor do they have a global holistic response, which is, what's your environment? Could you be exposed to mold? Have you had any water damage? That's what I ask. Not, do you have mold? People don't know that they've had mold. Have you had any water damage in the place that you're living in? Or did it happen before you were there? Oh yeah, well there was some black mold in the bathroom when we moved in, we just cleaned it with Clorox. Not good. So mold is insidious, it's dangerous, it can lead to dementia, it can lead to cancer. Very bad, you really want to clean it up. Here I gave some resources. Again, you don't have to copy them because you'll get the slides. But really be respectful of mold. Thank you for your contribution there. Lyme, the same thing, you really have to know to look for it, and a good functional medicine practitioner will do that. And it's treated with herbal things. The antibiotics can go on for years and years and still not kill it. Using the right herbal treatments can do it. Bipolar disorder, you really have to pay attention to the lifestyle. These people need to eat and sleep appropriately, get enough sleep, eat good food, get the good, right nutritional support, and look for underlying causes like heavy metals, like chemicals, like all the other things. So all these conditions aren't that different. You always need to consider all of these underlying causes that can lead to the same thing. Diabetes is totally treatable. Do you know that? It's totally treatable. Gabriel Cousens, I don't know how many years ago, 20 years ago, wrote there is a cure for diabetes. He took people to his Tree of Life retreat vegan center, yeah, you're nodding your head, and turned chronic, obese, difficult diabetics, turned them around. At the end, they had normal insulin and normal blood sugar. So what was the problem? Their lifestyle, what they were eating, their lack of good nutrients. So just know diabetes, which is a bad, bad disease, but if you don't treat it the right way, you end up in a mess. You can be blind, you can lose your foot. I mean, so many bad things. So just know it's quite treatable. So I'm going to just cover a few of the basic things that we need, basic nutrients. First of all, we need essential fatty acids, and I'll talk about that more just a little in the next few slides. CBD, who's familiar with CBD? Okay, I really like CBD. What it does is it interfaces with something called the endocannabinoid system. It's a system that communicates, it helps all the parts of your body to communicate, your hormones, your digestion, your brain, everything. It all talks to each other. And your neurotransmitters, if I didn't say that. So I use it for a lot of different things, for anxiety, sleep, pain, addiction, helping people get off of meds. It's really good for speech anxiety. So if I had any anxiety coming up here, I actually took some CBD before I came up. So there was a study they did and showed that people who were terrified of giving speeches and given CBD in advance got up on the podium and actually gave a speech. You know, it was not a real, it was a study, so it was an experimental situation. And there was a control group of people scared of presenting, and they were not given CBD, and they didn't do very well. They did as badly as they usually did. So it actually does something for social anxiety or before you go into a party. So very useful. And I have some in the back of the room because I have my own CBD company. I liked it so much and I wanted to have one that was non-GMO where I could control the ingredients. There's a lot of something called beta-caryophyllene in it, which is good for pain and anxiety and sleep. So you get more than CBD in my CBD. Then there's amino acids I keep mentioning that you need for muscle repair, for neurotransmitter function, and it comes from protein. So in order for that to happen, you need protein-rich foods, and you need to make sure you have enough stomach acid to break down the protein into the amino acids. And we give amino acids too, because some people just don't get enough protein. So we have to prime the pump by giving them specific amino acids to make specific brain chemicals or neurotransmitters. Multivitamin is great insurance. I take a multivitamin even though I take a lot of separate things, but there's some trace minerals and small dose vitamins that we still need. So there are some good ones around, which I'll tell you later how to get. And probiotics, we need our microbiome to be happy, to be balanced. In our microbiome, it's about 5 pounds of friendly bacteria. They make our vitamins, they help our immune system, they help protect the gut lining. So when you have a not so good or deficient microbiome, or you have bad bacteria in the mix, you're in trouble. You can end up with gut problems, leaky gut, which can lead to autoimmune issues. You can have depression. Remember I mentioned psychobiotics? So the psychobiotics, you take them as probiotics and they will help support your mood. So that's a good one. I wrote a book, Natural Highs, Feel Good All the Time, about 20 years ago. But it's still good. And it just tells you what you can take. in order to elevate your mood, repair your memory, and you're working with your own body. It's not a quick fix. It's what you actually do to heal yourself. And the importance of specific fats and oils, first of all, omega-3. So omega-3 are like fatty fish, chia seeds, flax seeds, walnuts, hemp seeds. These are all omega-3 fatty acids. Then there's the omega-6, chicken, sunflower seeds, pumpkin seeds, sesame seeds, corn oil, soybean oil, all the seed oils. And we need to have them in a specific ratio. I want to quote a study here that shows that omega-3 supplements can actually decrease aggression. They did a study in a prison years and years and years ago where they gave omega-3 fatty acids to prisoners, much less violence in the prison. And there was a meta-analysis done quite recently, which included 29 trials. A meta-analysis means they study other trials and a lot of other trials and put it together with 3,918 participants and showed that it is a complementary treatment for aggressive behavior. So people who regularly eat fish or take fish oil supplements are getting omega-3 fatty acids, which play a critical role in brain function. So poor nutrition is a risk for behavior problems. So just think about that. And think about kids, ADHD kids. They respond very well to fish oil, and that's part of it. It just calms down their brain. And to achieve healthy cell membranes, we need a 3-to-1 balance between omega-6 and omega-3. And this is the quote. This is the study that I'm quoting. So you can. I'm sure you're all going to run home and look it up, right? And here's another thing: suicide rates. They did a retrospective. This is amazing. Michael Lewis and Joe Hibble, who are two of my heroes in the world of essential fatty acids, did a study with the US military where they studied posthumously, that is, dead people who had died of suicide, and checked their brains, 800 of them, because they saved the neural tissue, and compared over many years. They saved a series, and they matched it with people with controls. That is, people who died not of suicide, but age and other parameters. And the conclusion was the risk of suicide death was 62% greater with low serum DHA. Now think of the human cost there. I mean, this is horrific. So essential fatty acids really are, it's really an important story. The high ratio of plasma omega-6 to omega-3 fatty acids associated with a greater risk of all-cause mortality, cancer, and cardiovascular mortality. This was a recent study based in the UK. So these are this is really important information. Now, how does the ratio affect the cells? When you have a messed up cell, I don't have a pointer, but when you have that cell there, it's kind of messed up. It has rigid walls. The nutrients get in very slowly. The waste products come out very slowly. Whereas when you have a healthy membrane, which is being fed sufficient omega-3s, you get improved brain function, hair quality, your hair is much better, heart function, skin elasticity, your inner organs function better, your joints and muscles work better. You know, it kind of oils your joints. So, as I said in the last slide, a 3-to-1 balance between the 6 and the 3 is essential. And so what are we going to do about it? First of all, increase our omega-3s, reduce our omega-6. So how do we know how to do it? When to take it? What amount? I say test, don't guess. We can test omega-6 to 3 ratio with a finger prick blood spot home test. And my colleague, who's a nutritionist and a really good clinician, Julie E. Health, is here to give us a little description of what she brought here to help us do that. Okay.
Hi, everybody. Hello.
Nice to meet you. I have a practice in the Redondo Beach area for almost 30 years. So what
Can you hear?
what Dr. Cass is showing you here is something that I talk about every single day. My original training is as a registered dietitian, and one of the first things I put my clients on is oil, because oil calms the nervous system. Oil is essential for your cell membrane, where the cell membrane, your cells should be like a sphere. And you could see it here a little bit. But so if you're getting enough essential fat, your cell membrane is like a sphere. If you don't have enough, it could be like a trapezoid or a weird shape or a rigid shape. And the importance of that is that even if you're eating incredibly healthy, the nutrients come into your cell through that cell wall. So if it's warped in shape, then the cell receptor site, which is on the cell, it's like a keyhole, and there's a keyhole around the entire cell for vitamin A, B, C, D, etc. And so when you eat it, you have a lock, you have a key, and the key is looking for the perfect little lock where it binds and turns and sends a signal into the cell, how your body absorbs nutrients, and also how the cells detox and get the junk out. So if your cell wall is not a perfect sphere, even if you eat incredibly healthy, but you're missing fat or enough fat, your body's not gonna get the nutrients in nor the toxins out. And in addition to that, the nervous system of the body is like the operating system of a computer. And Dr. Cass was talking about the fight or flight earlier. And so I find that every single person I work with is deficient in omegas, in the good ones. How many here take a fish oil or an omega-3? Awesome. So about half. I would say most people, when they come to see me, like 95% of them are taking it, but they're not taking enough. Or they're taking a poor quality one, as you were talking about, it's rancid. We've all seen food on a plate rotting, and it smells, or fish, and so it is important that the fish is clean, mercury-free, etc., it's tested, and then the way it's processed and put into the supplement also needs to keep the integrity of the nutrients. And so all nutrition is related to this. So what we have brought here today is a little finger prick test where you can literally just prick your finger just the way like the diabetics do. You almost don't even feel it. You drop 2 drops of blood onto a piece of paper, it goes off to a lab, and it comes back 15 days later and tells you your ratio of omega-6 to 3. And the first one of my clients that did this is a vegan for 25 years. She eats clean, she does holistic everything, she uses light therapy, she does all the everything. Her ratio was 40 to 1. And this is what I'm finding to be true almost across the board. And the company that is running the lab test is in Scandinavia, and the oil that they make is also from Scandinavia. And historically, for the 40 years that probably we've been in practice together, historically the best quality fish comes from Scandinavia. So what they do is in each bottle it's 30 pieces of salmon and 300 olives, and when they press the olives they get out the polyphenols and they add them back in. The same kind of polyphenols that are antioxidants for the brain and that come in raw cacao. And so what this company has done, which is so incredibly brilliant and gonna save all of our lives in so many different ways, is you test your blood super quick, and then you take their oil, which is in the perfect ratio balance. And you could take it off a spoon, you could put it on your food, it doesn't matter, just get it into your body, because inflammation causes all of the problems you just saw Dr. Cass talk about. And the new word is actually inflammaging. So if you want to age faster, keep the inflammation, but if you want to lose weight and feel great and improve your health, find out what your ratio is and start doing something about it. And sadly, the worst numbers are actually in children, and that's because probably most adults are taking care of themselves, but we all know parents are lazy and they feed their kids not as healthy as themselves because of time. So we say test, don't guess, and I truly believe that in the next 10 years, everyone in this room and everyone else that's not here that would normally be here today, the people on the same wavelength, will be doing at-home tests and learning everything about their nutrition, because just because you take it doesn't mean you have the right amount in your body. And over the last 10 years, maybe 20, we've had more at-home tests, but I believe in the next 10 years it's going to be the gold standard where we all know our numbers. We know our vitamin levels, we know our microbiome levels, and we know our inflammatory markers, and we can do something about it.
Thank you, thank you, thank you. Okay, I'm just about done. This is my ebook, Reclaim Your Brain, all about brain chemistry and what you can do. So you scan this to download. You'll also get a copy of this slide presentation that'll have it on it. So you may not need to get it right this minute. There's Fullscript, which I really enjoy Fullscript. It's an online platform where you can purchase discounted professional grade supplements that I recommend, and I have different recommendations for supplements on it. So that's Fullscript, because people, you don't know where to get your stuff. You really want to get professional grade whenever possible. This is a functional medicine resource. I don't know it really well, but I looked through it. I wanted to give you ways of learning things on your own and not, you can Google, and actually Google's pretty good. I mean, actually I use, what's the other one? DuckDuckGo, because I don't want to use Google, but anyway, this is a generally good resource. This is a really wonderful summit. It's a conference for 2 days at the UCLA South Bay Palos Verdes campus. And it's beautiful, and it's going to have so many activities you can do that are healthy, and it's going to be focused on being outdoors and having great lectures. The lectures will be indoors, but really an amazing conference. Look it up. The website is right here. But I have a resource that I wanted to show you. I had a resource page on my website. It's cassmd.com/resources. So just, you should know. Anyway, thanks for the opportunity. Thanks for being such good listeners. I'll be around. I'm going to relinquish the space. Thank you. Thank you. Thank you. Okay.